Now, let us understand why sound appears, what we are exactly doing by applying cuff, inflating cuff, and by deflating cuff. See, this is how you have applied the cuff, right? And when you are inflating the cuff, what we are doing is that we are obliterating the lumen. We are compressing the artery. So when cuff is inflated, that it will cause stoppage of the arterial blood flow. No sound can be heard through a stethoscope, which is placed over brachial artery distal to the cuff. Now, as you start deflating the cuff, gradually there will be flow of the blood, right? See, this is still compressed. As you start deflating the cuff, then slowly the lumen of the blood vessel will open, right? So it will cause flow of the blood. That will cause appearance of the sound, series of the sounds, that is called as the Korotkoff sound. As you deflate the cuff, at one point there will be no compression over the arterial wall. So blood flow becomes laminar. Now this is silent, right? So blood flow becomes silent when the artery is no longer compressed. So the point at which sound appears, first appearance, that is called as a systolic blood pressure. There will be series of the sound and finally the sound will disappear when artery is no longer compressed. So disappearance of the sound will give you value of diastolic blood pressure.